Checking in with Mercy Health St. Rita's, we've got an update on one of their urgent care facilities and on the illnesses that are going through the area. Joining us today, we've got Ryan Wurst. Thanks for joining us.
Yeah, thanks for having me.
Okay, first let's start. Let's talk about this West Side urgent care because we've seen the construction and the stages, and now, is it ready? Is it complete?
It is, yeah. Same address, same location, new building, new space. We've been seeing patients for a few weeks now, and it's going very well. And throughput's been great. Patients giving us great feedback.
That's awesome. So it's an urgent care. So what does that mean? How do we know when we should go there and when we should maybe go to the hospital?
Right. So you're right, it is urgent care. So it's kind of between family practice and emergency, although we can see a lot of family practice type visits. And a lot of it is availability as well. So we're walk-in, we're 8 a.m. to 8 p.m. Monday through Saturday and 10 to 6 on Sunday. So availability plays a lot into it as well.
Right, yeah. But if like you're having a heart attack, you think, or I don't know, stitches, can you take care of stitches there? I mean, when should we go to the ER and not you guys?
Right. So urgent care, yeah, a lot of minor trauma, injuries, sutures, splinting, hurt yourself, need to know if you have a fracture, viral type symptoms, and wanting testing, wanting to know what type of virus you have. Those would be urgent care type visits. And, you know, people with shortness of breath, chest pain, a lot of pre-existing conditions, maybe better to go to ER.
All right, awesome. All right, so we keep hearing there's a lot of respiratory illnesses out there. I think a lot of people know people who have had stuff. Where are we at with like RSV and the flu season and even COVID, especially after the holiday, Thanksgiving?
Yeah. So locally in the urgent cares, we're seeing a lot of influenza A. We are seeing a rise in COVID, nothing like last year, but there has been a little bit of a rise recently. And RSV, again, we're seeing RSV locally through the urgent care. Luckily, nothing like we're seeing across the country, but we are seeing RSV.
When do we know, like we're at home and we're like, okay, I can get over this, but when do we know that we should go to urgent care and like visit you? What are the symptoms that we should look for to know that you need some help?
Right. A lot of it's just how the individual is looking. I mean, if they are not responding well at home with just fluids and rest, and then, or there's a need because of pre-existing conditions, or to know what it is that's causing, or medicines to help you get through. Those would be good reasons to come see us versus staying at home and waiting it out.
Right. So we know with RSV that there's no vaccine for that, but there is a flu and still COVID vaccines and boosters. Have you seen that if people have those vaccines that they're not as bad off, or it doesn't matter?
Yeah, we are still seeing that. There's always a few breakthroughs where you have a positive after, after the vaccination. But in general, yeah, so you do see less influenza than those that were vaccinated, and the COVID symptoms as well. Yeah, less severe.
Okay, all right. So the West Side Urgent Care is open. Things are going well, and we've got respiratory disease in our area, so just be careful and get those vaccines.
That's right.
Okay, well, thank you very much, Ryan, for joining us today.
Yes, thank you.
All right, don't go away. Noon Edition continues in a moment.
Please join New